I'm Maureen George. I'm an assistant professor at the University of Pennsylvania School of Nursing. I am so excited to have this opportunity to bring this video to families who have asthma. I've worked in asthma for the last 2 or 3 decades, and we have great opportunities now to get asthma under control, to get the education out to the families who need it. And I am so happy that we have a vehicle through Healthy Hoops that really brings the knowledge and all of the resources to the families to make certain that they can get their child's asthma control. It really changes lives. I promise you that. You may know that asthma is a very common condition, but unfortunately in this country we have high rates of uncontrolled asthma. We always say to people that you should have no impediments. You should be able to go to work, go to school, be competitive in all of your sports and physical activity. When you have asthma, there's problems inside the lungs and that airflow gets obstructed. The air has difficulty getting to those smaller airways because the muscles are squeezing down, preventing airflow. And we have problems with swelling inside the breathing tubes, preventing airflow. We also have twitchy airways, preventing airflow. And then on top of all that, there can also be more mucus production, which is making the small airways even smaller. So the challenges are quite severe. If you are using too much of your rescue medicine, that's a sign that your asthma is not under control. And we usually say that if you need to use your rescue medicine 2 times a week or more to rescue yourself from asthma symptoms, your asthma is out of control. But that's not the only thing that may be signaling poor control. It may be that asthma is waking you up at night. So if you're waking up more than twice a month because of asthma symptoms, that's a sign that your asthma is not controlled. There are other medicines that you might need to take, oral steroids, which are potent anti-inflammatory medicines. If you need to take them several times a year, or your child is prescribed them several times a year, that should have you concerned that you have uncontrolled asthma. And then there's lots of other things that may signal a problem. A problem with poorly controlled asthma might be an emergency room visit, a hospitalization, an inability to exercise as long or as hard as somebody else, so that you look at your peers and you realize that you are taking more rest breaks, that you don't have the endurance that you typically have. You may not be able to go to work or school, or if you go to work or school, you may not be as productive or attentive. All of those things would be an indication that your asthma is not as well controlled as it should be. And it's an important conversation to have with your doctor or with your nurse. The important things that we like to highlight is having a regular relationship with a doctor or nurse that you see not just for emergencies, but for routine asthma care. I can't emphasize enough how important that is. Controller medicines are really important if you have persistent asthma. There are 2 different types of asthma. Intermittent asthma means it comes and goes only when you're exposed to a trigger. Not that many people have just intermittent asthma. Most people have persistent asthma, meaning that it's there all the time, even if you're not aware of it. So a controller medicine is used every day, even when you feel well, even when you don't have noisy asthma, to keep the asthma under control. Even in situations where people have pretty good control of their asthma, they may get a cold, they may get exposed to a trigger they're not anticipating, and lose control and have an asthma attack. It happens to everyone. And so there has to be a second group of medications that take care of that acute asthma attack. And we call that second group of medications rescue medications, because they work quickly to rescue you when you're having an asthma attack. There's some important things that people need to know about rescue medicines. You really do need to carry it with you at all times. You need to understand how to prime the medications, that is, to prepare the medication to release the right dose. You need to know how to take care of the inhaler in between doses so that the nozzle stays clean and unclogged. You have to make certain that it hasn't expired if you don't use it often. Some of the inhalers have a dose counter on them, which is really helpful because you can look at that dose counter and know exactly how many doses are left in it. Common allergens would be things that you would be allergic to in certain seasons, like pollens and grasses and molds. Or it might be something that you're exposed to year-round, which we call a perennial aeroallergen as opposed to a seasonal allergen. And those year-round allergens include things like dust mites or pets that might be in the home, things that you're exposed to on a regular basis. Irritants, on the other hand, are things that don't cause an allergic reaction, but they can cause an acute asthma attack. And those are things that are more like odors, scents, pollution, such as fumes. Those are the things that we commonly think about, including the biggest known irritant, which is cigarette smoking. We often think that a combination of a doctor's visit, which may include testing for allergies either through skin testing or blood testing, in combination with a home visit, as well as a good history asking about symptoms in relation to exposure to triggers, probably the best way to figure out what are the exact triggers for your asthma. An asthma action plan is one of the most important things that anyone with asthma have developed for them and really tailored to their individual needs. Your healthcare provider should help you develop a plan for the green, you're good to go. Your yellow zone, which would be additional steps that you take in case you're losing control of your asthma. And most importantly, what steps to take when you're in the red zone, which is stop, it's an emergency, take care of only your asthma. In addition, you need to have important instructions for what happens when you're in the yellow zone, you're losing asthma control, or the red zone, which is your danger, your emergency situation. And when will it be important to get on the phone and talk to your healthcare professional, get into the office that day to see the healthcare professional, and in rare circumstances when the condition is so serious that you actually need to seek emergency services. Having an asthma attack is one of the most frightening things that can occur if you're an individual who has asthma or if you're a parent caring for a child. The most important thing to remember is to stay calm and think clearly because it is an emergency situation. You want to sit down, relax, and allow the individual to lean forward in a position that's comfortable for them. Locate the rescue medication and administer it immediately and correctly as per your healthcare professional's advice. But if you're not receiving relief from the rescue medication in a set number of doses or in a set period of time, typically not more than an hour, if you're not getting relief or at any time that you're getting worse, then you do need to get on the phone, talk to your doctor or nurse, or if the case is getting more serious, you may need even to call 911 for rescue treatment. When you receive a diagnosis of asthma, or as a parent hearing that your child has asthma, you might be afraid at first, scared and overwhelmed. And what I would want people to know is that it's going to be okay. Asthma can be controlled. We have great drugs, we have great treatments, we have great ways of making certain that your child or you yourself can do everything that you want to do. There's no reason to hold you back. Living with asthma is easy. All it requires is that you learn and take control of the knowledge to really empower yourself to be in charge of your condition and work with your healthcare professional. Together, you're going to be a great team.